Welcome to The Explainer. All right, today we're tackling a big one, cancer. It's one of the biggest challenges in medicine, for sure, but understanding it is always the first step. So we're going to break down how it starts, how we find it, and most importantly, how the battle is fought. So let's just jump right in. What actually happens when one of your body's own cells basically goes rogue? We're going to explore the story of cancer, not just as a disease, but as a kind of internal rebellion, a civil war that happens right inside of us. And it all starts with just one single cell. So our story really kicks off at the tiniest level imaginable. Think of our body as this bustling city of cells, all working together. Well, our story begins when one of those cells decides to just break all the rules. It betrays the community and sparks a rebellion. To really get it, let's look at this side by side. On one side, you've got your normal cells. They're the good citizens, right? They listen to signals, they have specific jobs, and they know when to stop growing. But cancer cells, they are total anarchists. They grow without any permission, they never really mature to do a useful job, and they completely ignore all the signals telling them to stop dividing. They just create chaos. So what's the big takeaway here? At its core, cancer is all about genetics. It all starts when a cell's DNA, its instruction manual, gets damaged. That mutation breaks the internal machinery that controls growth. It's like a switch that gets jammed in the on position, and it just won't turn off. Now, this cellular betrayal, it doesn't just happen in a flash. It's a process, and it has a name, carcinogenesis. It happens in three main steps. First up is initiation. That's when something, maybe a chemical or radiation, first damages the cell's DNA. Next is promotion, where that mutated cell is encouraged to start dividing over and over. And finally, you get progression. That's where these altered cells get more and more aggressive, invading nearby tissues and even spreading to other parts of the body. Okay, so if this rebellion is happening deep inside us, how in the world do we find out about it? Well, luckily, our bodies and, of course, modern medicine have some pretty sophisticated alarm systems to spot the trouble, hopefully before it gets too out of control. To spot those early warnings, there's actually a really great mnemonic to remember. Caution US. Each letter stands for one of the classic signs our bodies might give us. A nagging cough, for instance, or an obvious change in a mole. Think of these as the body's smoke signals, trying to warn us that there might be a fire starting somewhere inside. So once those alarm bells start ringing, doctors need to figure out exactly what they're dealing with. They use a system called TNM staging. T tells them about the size of the primary tumor. N is for whether it's spread to nearby lymph nodes. And M is the big one. It tells them if the cancer has metastasized or spread to distant parts of the body. This is absolutely critical for figuring out the best way to fight it. And once the enemy is identified and sized up, it's time to launch the counterattack. The battle plan usually revolves around three main strategies to push back against this cellular rebellion. The first strategy is the most direct one you can get, surgery. Think of it like a special forces raid to physically go in and remove the enemy's stronghold. This can be anything from a local excision, just taking out the tumor itself, to a more radical surgery that removes the tumor plus nearby tissues and lymph nodes, just to make sure no rebel cells get left behind. Next up, we have what you could call the precision airstrike of cancer treatment, radiation therapy. This strategy uses these super high-energy rays to zap the cancer cells, damaging their DNA so they can't grow and divide anymore. It effectively stops the rebellion right in its tracks. And this airstrike can be delivered in a couple of ways. You can have external radiation, where a machine directs beams at the tumor from outside the body. In that case, the patient isn't radioactive. Or you can have internal radiation, where a tiny radioactive source, like a seed, is implanted right inside the body next to the cancer. With that method, the patient actually does give off some radiation for a while. And finally, if the rebellion has started to spread, you gotta bring out the big guns. That's where we get to the all-out ground campaign, chemotherapy. This uses powerful drugs that travel through your entire bloodstream to hunt down and destroy those rebel cells, wherever they might be hiding in the body. But this kind of all-out war, it's not clean. It doesn't come without consequences. These incredibly powerful weapons we use to fight cancer can unfortunately harm healthy cells in the process. It's collateral damage. The thing is, treatments like chemo and radiation are designed to go after cells that divide really, really fast. And they're great at that. The problem? They can't always tell the difference between a cancer cell and, say, a healthy cell in your hair, or your stomach lining, or your bone marrow.
And that's what leads to side effects like hair loss, nausea, and a seriously weakened immune system. And this really gets to the heart of the matter, you know? It's the classic double-edged sword of chemotherapy. The drugs are designed for one thing, destruction, but their power isn't perfectly targeted, and different drugs come with their own unique set of risks. For example, this really potent drug, doxorubicin, is known for being cardiotoxic. That means it can actually damage the heart muscle, which is a huge risk. Then you've got another one, bleomycin. This one can cause something called pulmonary fibrosis, which is basically a dangerous scarring of the lungs that makes it incredibly difficult to breathe. And there's vincristine, which can damage the peripheral nerves. This leads to a really painful condition with numbness and weakness, usually starting in the hands and feet. So, knowing all these risks, you have to wonder, right? How do medical teams protect the patient through all this? How do you fortify the body's defenses when the immune system is down and a person is at their most vulnerable? Well, when a patient's white blood cell count just plummets, that's a condition called neutropenia. A special protocol kicks in. It's all about creating a protective bubble around the patient. We're talking a private room, super strict hand washing for anyone who enters, and no potential sources of germs, like fresh flowers or raw fruits. It's all about shielding the patient when they need it most. And for patients who are getting that internal radiation, the safety plan for caregivers and visitors is actually pretty straightforward. It all comes down to 3 core principles. You limit the time you spend near the person, you maximize your distance from them, and you use shielding like lead aprons. It's a simple mantra, really. Time, distance, shielding. When you look at the whole picture, from understanding a single cell's betrayal to building these complex battle plans and safety measures, it's just a remarkable human endeavor against this relentless enemy inside us. And it leaves us with this final, really hopeful question. With every single new discovery, are we getting closer to finally winning this war? To turning every one of these cellular rebellions into a lasting, permanent remission?